Well, as of today, it's the youngsters' turn for the jab. Between the ages of 12 and 17, they can get the COVID-19 vaccine. The health department recommending, though, that teenagers be accompanied by a parent or adult. And I know it's causing a lot of anxiety with parents and guardians. So let's speak to well-known paediatrician, Dr. Iqbal Karbanee, joining us this morning. Dr. Karbanee, good morning. And let's talk a little bit, if we could, first of all, about the safety of the vaccine for teens. Some people aren't convinced it's a good idea.
Yes, I think it's a very important topic because it's about time we started vaccinating this age group for a variety of reasons. But to address your question of safety, there's no doubt that, as with any vaccine or any intervention, it's always a risk-benefit ratio. And in this case, the benefit far outweighs any risk. So even though the risk of taking the vaccine is extremely, extremely small statistically, and this is based not only on our experience, but on international experience, the vaccine is extremely safe and compares favorably to international vaccines. Saying that, however, remember that the vaccine that's been approved for the 12 to 17-year-olds is a single-dose Pfizer vaccine, not the double-dose J&J vaccine.
And as far as parents concerned, I think this is not necessarily the only concern for parents, Doctor, about the getting the vaccine. We all had vaccinations against measles and the flu and whatever else we got as youngsters. I think a lot of it's got to do with the consent issue as well. Is this fairly unusual in your experience for children to get a vaccine without consent of parents? It seems to be the hot topic.
It is a hot topic, but I think it's just highlighted the fact that most people don't know that in the Children's Act in South Africa, children from the age of 12 don't actually need consent of the parent or the guardian in order to achieve medical intervention. So, we don't normally vaccinate very much from 12 onwards. There's the optional vaccine for HPV, and there's a couple of other vaccines that are given, but it's never been to this degree where there's such national exposure. So I think it's purely just brought the highlight and spotlight onto the fact that from the age of 12, children technically and according to the law and the Children's Act in South Africa don't actually need the consent of the adult or the parent. It would be great, and we encourage parents to go with their children, the guardians to go with their children to get the vaccine. In fact, it would be great if the children could, sort of make this a family event and everybody goes together to have the vaccine. Because one of the reasons why the vaccine has been introduced is purely because there's a surplus of vaccines at the moment, and that's because of poor uptake in some of the older age groups. So let's encourage the children to hopefully take the vaccine and drag everyone with them when they go have the vaccines done.
Yeah, if the teenagers can start making it cool for vaccines, who knows, maybe we'll get more done before Christmas. Doctor, if you don't mind, I got a tweet earlier from Sandra Fernandez tweeting me at Gareth Edwards SA, just asking me about registration online for 12 to 17-year-olds. This is not part of our discussion. I thought, let me just throw this in. To those wondering, no, you don't need to register your children on EVDS. The health department saying they can simply walk in, which I think, Doctor, will help in getting the numbers of vaccinated teens up quickly as well.
The government has made it as easy as possible. You can basically walk into any vaccination center and simply produce some form of ID and you'll be vaccinated. So there's no doubt that there's no registration, there's no onerous process, the red tape has been cut. The aim is to get out there as many people as possible need to be vaccinated as soon as possible. So remember that for us to be vaccinated, the aim here is that we should try and reach a critical mass, or what people call herd immunity, or even just a significantly higher level, so that we can reduce transmission rates. And that will reduce the risk of a next wave coming through. It will increase the possibility of us getting back to some semblance of normality in a social level as soon as possible. Because especially with children 12 to 17, their social habits are different to adults. They tend to socialize more. They love to go out in groups. They tend to engage in, sort of much more behavior that's out there. And those children, even though their risk of hospitalization is far less, the risk of transmissibility or spreading the virus is much higher. And that's why we want to encourage children between the age of 12 and 17 to have the vaccine as soon as possible.
Doctor, perhaps my last question to you on the side effects. You and I have spoken many times. Side effects are a bit of a problem for us oldies because we're all taking some kind of chronic medication. We've all had diseases in our lives. I imagine side effects for teens not as bad because I imagine they're a lot healthier than I am, for example.
Yeah. No, that is true. The side effect profile is far less in teens. Remember, there are teenagers with chronic diseases, so those are a higher risk group, the same way as adults are. there is a slightly higher risk of certain complications. But even then, when we say higher risk, people tend to panic. So let's keep this in perspective. What do we mean by higher risk? The risk is basically about 2 to 3 in a million, which is extremely low, an extremely low risk. So even though there is a risk that has to be disclosed, that risk is statistically so small that, it should not be a problem at all. So that's why, even though, the side effect profile is there, and some teens may, for sort of example, have the psychological barrier of getting poked with a needle, or there may be some other issues, and there may be sort of fear of getting flu-like symptoms. I think it's really important that, as you said, teens, they need to understand that it's cool to have the vaccine. It's cool to be at the forefront of preventing another wave. And the sooner they do that, the sooner we can get back to some form of normalcy in society.
Doctor, yes, it's all about making it as cool as possible, isn't it? Very quickly, Doctor, I just got this tweet now from Tracy Lee at Gareth Edwards SA. Thank you, Tracy Lee. Please ask the good doctor about kids with diabetes. I didn't think of asking that. It's a good question, Tracy Lee. Thank you.
Children with comorbidities are at higher risk of complications of COVID. There's no doubt about that. And children with diabetes fall into the high risk category and must be vaccinated as soon as possible. There is some argument or some case that can be made for children with high risk disease to get the 2-dose vaccine. But I would suggest that someone like that actually sees a specialist and gets one-on-one advice. But for the general public out there, the take-home message is that teens should all get the vaccine. They should all get the single-dose Pfizer vaccine as soon as possible, so that when we're going to exams, when they're going back to school early next year, the risk of transmission in the school environment is reduced as much as possible. But children with higher risk or higher profile of getting complications should then probably get the 2-dose vaccine, and that should be discussed with their doctor first.
Well, I appreciate your time, Dr. Iqbal Karbanee, and I'm sure all the viewers appreciate your advice as well for their children. Paediatrician, well-known Dr. Iqbal Karbanee, joining us here on eNCA.